Hello, I'm Dr. Musa, board certified OBGYN RAI. I'm going to talk to you today about embryo transfer. What is embryo transfer and how do we do it? To be honest, the process of IVF is kind of a little bit long process. Usually it takes many steps preparing for the patient from the beginning of consultation until transferring the embryo for the patient. We start at the beginning with studying the patient. How the age of the patient is very important, number of eggs that she has, which we usually study by doing two things: transvaginal ultrasound and counting the embryo and counting the antral follicle counts, and at the same time doing another hormone lab, which is a blood test. It's called AMH. After doing like this and after studying the partner, sperm analysis, etc., we decide what will be the dose, which and protocol we are going to use for these patients, what will be the amount of injections, how many units each day, etc. We discuss all this with the patient and we start the process. Usually it takes up to 2 weeks, and then the patient will be ready for egg collection. And at the time of procedure, the patient will be under light general anesthesia. After that, the patient is done and the work will be in the lab, and the lab director will start inseminating these eggs with the sperm of the patient, of the partner of the patient. And we usually incubate them in the incubator for up to 5 days, 6 days, and we check and change the media for these embryos periodically. It's all in the lab and under supervision of the director of the lab. And then we get at day 5 or 6 number of embryos. The embryo at day 5 or 6, we call it blastocyst. And the blastocyst usually it contains of 2 parts. The outer side, we call it the ectoderm, and this part will produce or develop later in. It will develop the placenta, the cord, the amnios, the accessories of the embryo. The other side is inside, we call it the inner cell mass, and this one will develop into the real embryo. So we are now at day 5 or 6, and we have, let's say, 5 or 7 blastocysts. And these blastocysts, usually we give them a grade. The grade will be into letters. I always make it a joke and say it's like the students, and when they do exam, they have kind of grading. And so these blastocysts also have a grading, a way to know how good they are. So the grading has 2 letters and it has numbers. The numbers will reflect, the higher the number, the better is the blastocyst. So we will tell the patients you have 4 AA or 5 AA or 3 AB, etc. So there will be 2 letters. One letter will reflect the quality of the inner cell mass that will produce the embryo, and the other letter will reflect the outer part of the embryo or the blastocyst, which is called the ectoderm, and that will develop later into the placenta and the embryo accessories. And at day 5 or 6, the lab will take a biopsy from the embryo. The biopsy will be taken from outside of the embryo, which is the ectoderm. So we don't take any cell from inside the embryo. And this will be sent to the lab for genetic study. Usually it takes at least a week, and then we will update the patient to tell her, so you collected this number of eggs, we fertilized them, and then at day 5 or day 6, we had, let's say, 7 blastocysts, and we sent 7 biopsies to the genetic lab, and we end up by having 4 or 5 normal embryos. So the normal embryos, we call them in our terminology language as euploid. The abnormal embryos, we call them as aneuploid. So we tell the patient at the end, you have 5 embryos, normal embryos, and we have 3 girls, 2 boys, etc. And you have, for example, 4AA embryo, 3BC or AB, etc. We give her the grade and the genetic result of these embryos. We do consultation for the embryo transfer, and the patient discuss what does she want, what's her plans, what's her goals for her like future family. Let's say she wants a girl. I just transferred a girl, by the way, now 5 minutes ago. And it can be say that I want a boy, I want a twin. Usually we always discourage them from having a twin because to get pregnant with a twin is not easy. It has impact. I'll explain it in another video. Now we are ready for the transfer. We check the cavity, which is called cavity clearance. You can go to a video under the name of cavity clearance and see what is going on. Day of transfer, the patient comes, there's no anesthesia, there's nothing. The patient comes with full bladder. The most discomfortable part is when we ask the patient, full in your bladder. Drink water, come here, the bladder will be full, and we will do it while you are awake. We take the patient to a special room like the OR. She will be awake, she will be laying on the bed. We'll put we put abdominal probe to check the bladder is full and the uterus is normal. And then speculum, we clean up the cervix, we take off all the mucus that is there. We clean up the area with certain media that is the same fluid that is considered a nutrition to the embryo. And then in a very tiny catheter, we go slowly inside the uterus under the vision of the ultrasound, and we put the embryo in. First of all, we do what is called mock. It's a trial. I want to show you, this is actually the catheter. You see how flimsy it is. It is very flexible. And as you see, it has 2 parts, the outer part and the inner part. And usually we go in, the embryo will be in this flimsy, very flexible, elastic part, and it goes together. We go slowly inside the uterus. We see it on the ultrasound, and then we push the embryo inside the uterus. The embryo will be seen as a white spot on the uterus, inside the uterus. We ask the patient to be relaxed for 10 minutes. Then she is done, and she will be hopefully have a wonderful results. I hope I help with this explanation about the embryo transfer, and we will talk about more details in another video. Take care for now. Bye bye.